This is a case of tubo-ovarian abscess on CT. We have an axial CT starting from the lung bases. There's the heart, there are the lung bases. Scrolling down, we can see that this is a contrast-enhanced CT. We have enteric contrast in the stomach and IV contrast in the aorta and vessels of the liver. This is a fairly late phase of contrast. You can see some of the contrast is already being excreted by the kidneys. Patient presented with pelvic pain and fevers. It's a female, and you can see the uterus is this midline structure here, a little bit of that low-density endometrium. And on both sides of the uterus are these cystic structures that have thick enhancing walls. These are the adnexal regions right up against the uterus. You can see that some of them appear more circular while some are tubal in configuration. Given the history, these are compatible with tubo-ovarian abscesses. They look like abscesses you might find elsewhere in the body. Again, cystic, thick, enhancing walls. It's often difficult in these cases to distinguish what's the tube and what's the ovary, just because of all the inflammation, but in this case, the treatment is the same, antibiotics. Percutaneous drainage is an option for some patients who don't improve with antibiotics, but often they'll try to just treat with antibiotics and see if they resolve. One other note here is that the patient has a bit of an inflamed edematous cervix, so the patient also has cervicitis, which can go along with pelvic inflammatory disease. The take-home points for this case are that tubo-ovarian abscess is a complication of pelvic inflammatory disease. On imaging, they look similar to abscesses elsewhere in the body, so look for tubal wall thickening and enhancement. And abscess drainage is an option for patients who don't improve with antibiotics.